Hello everybody, my name is Dr. Vikas Dua. I am the Principal Director and Head of the Department of Paediatric Haematology, Oncology and Bone Marrow Transplant here at Fortis Memorial Research Institute, Gurugram, Haryana in India. So friends, being a pediatric hematologist, oncologist and a transplant physician, we see patients from day 1 of life to 18 years of age who have got blood disorders, who have cancers and who require bone marrow transplant. And when it comes to a complex procedure like bone marrow transplant, we also understand the fact that the patient may have complications. Complications can be in the form of graft versus host disease, in which the donor cells are going to react with the patient body and can harm the skin, gut, and liver. Complication can be in the form of a graft failure, in which the patient doesn't accept donor cells. Complication can be in the form of organ toxicity, where the drugs are causing damage to the organs of patient's body. And last but not the least, infections. Infections happening in the post-transplant period is a significant cause of morbidity and mortality. Infections can be bacterial, can be fungal, can be viral. Bacteria you can get from outside, inside. You can have fungal infections from outside, but when it comes to viral infections, majority of times you have your own viruses which reactivate. I'm not saying in each and every case you will have a viral reactivation from inside, because sometimes the respiratory viruses, influenza, RSV can come from outside and can cause complications, can cause pneumonitis. But many a times your own viruses like cytomegalovirus reactivates. We all in India, when we say in India, I would say 99% people are seropositive. That means they have had CMV sometimes in their life and it has been just latent in the body. But when it comes to transplant, when a patient gets immunosuppression, that CMV can reactivate in the post-transplant period when the donor cells start working in patient's body. And there are medicines available in this country which are doing a wonderful work for CMV, viremia and CMV disease. I would say both of them. The most common medicines which we've been using for CMV are called ganciclovir. You can use a drug called Foscarnet, and last but not the least, a new drug which is called cidofovir can also be used. Majority of the centers are been using ganciclovir as a first line therapy, but Foscarnet is an equally effective medicine for CMV. There are times when patients have got low white cell count, low hemoglobin, low platelet because of ganciclovir. Because myelosuppression is a very common side effect of ganciclovir. In that case, you cannot continue that patient on ganciclovir, because if you keep on giving ganciclovir, the patient will have marrow aplasia. Though you might be treating the underlying disease, you might have cured the patient of the underlying disease, but his marrow is now empty and he or she may require a second transplant. So in a situation like that, there are guidelines when to switch to Foscarnet. Foscarnet, a comparatively safer medicine, which doesn't cause myelosuppression, though it has got its own side effects like nephrotoxicity, but that nephrotoxicity can be easily managed. When somebody has been having a poor graft function, a patient who has got an empty marrow but the donor cells are 100%, you call it poor graft function, and has got a CMV reactivation, in that case, you cannot use ganciclovir, you have to use Foscarnet. So the point which I would like to highlight is Foscarnet is a wonderful drug which works really very well in CMV viremia and CMV disease. When I say CMV disease can be CMV pneumonitis, CMV enteritis, CMV esophagitis, CMV hepatitis, CMV encephalitis. So if you have a CMV end organ involvement, in that case, you require medicines like Foscarnet and ganciclovir for a prolonged duration, for a longer duration. It may last for, the duration may be anything between 6 to 9 weeks. But if you have a CMV viremia, usually a patient gets medicines like Foscarnet and ganciclovir for 4 weeks. So the message which I would like to give you all is very simple. Foscarnet is a drug which works very well in CMV viremia and CMV disease, and if you don't have an access to Foscarnet, try to arrange that for your patient, but because in some cases it may be life-saving. With that, I would like to thank you all for the patient hearing, and I wish you all the very best. Thank you.